Thank you very much, Simon. So the aim of this talk is to consider vaccines not just as medical technologies, but as social technologies too, when thinking about the future of cancer vaccines. And I mean, I'm a social scientist, so of course I would say the social side is important. But I think we can think about cancer vaccines using lessons from messaging and public reactions from other vaccines in the cancer realm already. Of course, this might not play out quite in the same way, but I think it's useful to reflect upon and think about these examples when communicating some of the new ideas we were talking about today and how they might enter public discussions, how they might affect views and behaviours. Some might be expected and some will be unexpected ways that they do this. Okay, so thinking about the HPV vaccine, which we've talked about a bit this morning, the human papillomavirus vaccine, Gardasil. So when this was first rolled out by the pharma company Merck, it's been covered quite a bit by social scientists, including in a book by the public health professor Laura Mamo. And what she was finding here is that there were two misconceptions that were perpetuated by a US campaign after this vaccine was first approved for use in 2006. And this was that HPV vaccine was only for girls, and that sexual transmission was not a concern. And I think you can see from the adverts here, the taglines were including "Make the connection," "Tell someone one less about a silent disease," about a cancer that is caused by a STI. And this was tended not to be communicated so explicitly. These adverts tended to be pink and including girls. And there were reasons for this. So, of course, females were only included in the initial efficacy trials, but it did make it harder for uptake later when made available for males. So, also leaving out this question of sexual transmission did mean trying to avoid controversy, and that was why HPV was kind of labelled as the cancer vaccine. One worry was that it might encourage promiscuity. To address that, sexual transmission was connected here. And in the US, of course, this was something of a big discussion topic, given the cultural and moral politics of this country. But there were also another set of related concerns about sexualizing too early, whether the vaccine needed to be administered, if there was a cervical screening program that was working. What's taken time is to show that the vaccine doesn't actually increase promiscuity, for this vaccine also to be normalized with that preteen and teen age group, and also to show the huge success in reducing cervical cancer rates that works in conjunction with a screening program. So next, and this part was more unrelated to the marketing and PR of the vaccine, but is a similar issue for what we see for vaccines more generally. And that's that they can be subject, of course, to public worries and also controversy, particularly about safety. So here the government, public health authorities, also the media and pharma company responses are all really important. HPV vaccines have been rolled out first in high-income countries, although low and middle-income countries are now adopting this vaccine, and policy and public receptions will be important. Indonesia's one current example. But what happened in some of the high-income countries? So we had Ireland, Denmark, and Japan, where there were reports of neurological reactions in girls. This did prompt organised resistance, especially in Ireland, with one group called Regret, and that was covered in newspapers like this one shown on the slide. There was also a documentary questioning vaccine safety, which had aired in Ireland, and a similar documentary in Denmark. So regulatory agencies did investigate these reports and found there was no causal link. It appeared that the reactions were probably psychosomatic. It was a vaccination that happens in school and affecting, among groups of girls, and that's been the theory about why neurological reactions had been reported. But then the reaction of different governments were a bit different. So Japan actually did drop their recommendation for the vaccine completely for over a decade, and that's only recently been reintroduced. Uptake has only just started to recover. So in Denmark, uptake has increased, but in Ireland, there's been a really big turnaround, as we can see from this graph, and rates have actually continued to improve post-2020. They are still lagging in Japan, and maybe this is connected to it only being recently that the government has recommended the vaccine again around the time that COVID vaccinations were happening. There was quite more isolated mainstream support for the vaccine, with the exception of one doctor in Japan called Riko Morinaka, who stood up for the vaccine and intimidation from anti-vax groups, which is not easy to do. And she was awarded a prize called the John Maddox Prize for promoting science in the public interest for her efforts. In Ireland, officials have been credited here with setting up a steering group which identified stakeholders to promote the vaccine. And they organised focus groups with parents, adapted their information material. They started using more quotes from girls and mothers and also experts, and produced new online content and videos. They did training for that school-based programme and produced new materials for GPs and pharmacists. And something to note is a young woman called Laura Brennan, who spent actually the last year of her life with terminal cervical cancer, campaigning for others to receive the vaccine. So what's the state today? HPV vaccine being connected to sexual activity has been shown to be less of a concern to parents. Just putting up this John Hopkins survey, but safety and the necessity for the vaccine for boys as well as girls is still being questioned. More recent pharma company adverts like this one have been trying to address these worries, and I think you can see it's obviously much less gendered. This particular campaign won awards. It's been aimed at teenagers and encouraging them to have the knowledge and also not shying away from its sexual relation connotations. Another vaccine that's worth considering is the Hep B vaccine. And I think we can look at Hep B as something that has been called the first cancer vaccine. The developer of Gardasil, Merck, had maybe wanted to avoid controversy that they'd seen with the Hep B vaccine in their original marketing. And the experience in the 1980s was that there was an association with those at-risk groups of Hep B, and that included drug users and also other risk-taking activities with this virus being spread by bodily fluids. So these were the initial target groups. It was later that there was some reluctance from parents about whether this was needed for a vaccine against children. And there'd been a change from, at least in the US, but also in other countries now, from vaccinating particular at-risk groups to vaccinating infants. And this worry kind of is encapsulated quite well by Jim Carrey, who has been quite outspoken against vaccination, speaking on Larry King Live, and he asked the question, do we really need hepatitis B on the second day of life? Again, there were some safety worries in the late 90s about a possible connection with multiple sclerosis, but then after numerous studies, that possible relationship has not come to fruition and shown not to worsen or cause MS. But during this time, again, France decided to halt the vaccine while investigating adverse events. And that does send out a message that your government is not so confident in the vaccine. And it added to the ongoing stigma of a vaccine being related to taboo people and taboo behaviours, and reasons for the Hep B vaccine being an issue for parents. So the move away then from a connection with at-risk groups meant making the case again for this being a cancer protective vaccine, as you can see this promotional image in the US about Hep B being for babies to protect against cancer. Okay, so I think we can see that there's quite a lot in the messaging of vaccines for cancer that needs to be thought about. And what can we consider then for the future of cancer vaccines and public attitudes? Something that we talked about today is that cancer is high on the list of public concerns about health. And you can see this in a 2001 survey, which was asking if a new vaccine or drug could protect you or your family members against one or the following types of illnesses during life. And listed on there was Alzheimer's disease, dementia, heart disease, stroke, depression and anxiety. And cancer comes out on top, and you see this in similar types of surveys. So the biggest group in this survey, about 50%, had said that improving protection against cancer was really their highest priority. And so emphasizing that protective or therapeutic benefit for cancer is worthwhile. But I think it's also crucial not to miss out some of those other important aspects of a disease, as we saw with HPV and Hep B, about how a disease is transmitted, also who a vaccine is for, and why it's important. That new technology aspect, which we've been covering a little bit about, and is something that we've also confronted with the COVID-19 pandemic. And misinformation and worries about safety are likely to be similar concerns with new cancer vaccines. And we've talked about mRNA technology, which obviously came from cancer research, but a key reason for COVID-19 vaccine hesitancy was apprehension about new technologies that were judged to be developed too fast and not tested adequately to know the long-term effects. This is one study that was mapping global public perspectives about mRNA vaccines and doing a social media analysis. And you can see some of the topics that come up are about conspiracies, views of vaccines as being experimental, worries about the biological mechanism of a new technology, and possible adverse events, which might be these side effects that haven't been confirmed to be related to the vaccine or not. And then finally, safety, especially for children. So these are things that we need to be considering as potential worries for the population. On that conspiracy theory end, there were quite a number of rumours about mRNA altering DNA, and this can be maybe thought of as an unease about something new, and a challenge about the trust in the people who are administrating and behind the vaccines. And there were going to be some quite new ideas communicated about cancer vaccines, and we've talked about those three types of possible cancer vaccines. So the idea of prevention and treatment, but also preventing not just against a virus or a pathogen, but pre-cancer. That's going to be quite a nuanced idea to get across. Other aspects might be that element of personalisation, which is something we haven't encountered really before with vaccination against infectious diseases, and quite a novel idea. And lastly, as part of this, I think there might be questions about whether vaccine is the most useful term to be using. I'm sure this is something you've talked about before, and whether some sort of label about preventative therapy would be more palatable to people. If vaccination is just associated with prevention against infectious diseases. Also, that wider connection to cancer, though, might be helpful to rehabilitate vaccines in the public space. So we do also have maybe a wider effect for other types of vaccination, not just in the cancer realm. So what should we do about this then? We've talked about communication and engagement already, and in the infectious disease vaccine space, asking parents on their views about childhood vaccines has been like a key area of research. And there are some learnings from reviewing that literature about communication and also interventions in this area. Just listing one literature review up here that you often see similar sorts of findings in more recent ones as well, about having clear and simple messages in a variety of formats, making sure you're clear about answers to questions, having information available through a wide range of health and community settings, dedicating that time to have discussions, and also a supportive environment for decision making, which of course isn't always possible in resource strapped environments. But then making sure that information is as neutral as possible to put across, and being in the, at least perceived to be in the child's best interest. Also now we're seeing more of a challenge with misinformation online, and having strategies already developed to respond to media stories and rumours can be very helpful. In terms of the sort of interventions that might be thought about to aim at communities to inform and educate, we know that interventions do increase vaccine uptake, but they can be resource intensive, and maybe having them more targeted to particular areas or groups that we're particularly worried about might have a better chance of increasing vaccine rates. Also to add here, at this stage, possibly a public consultation and thinking about how to involve different stakeholders to have them input into future messaging is something to consider, because when we've had new technologies being introduced, whether that be GMO or other big scientific discoveries that will have an impact on society, public consultations have often formed a part of announcing a new technology and its possibilities, but also considering what negative consequences there might be. And one stakeholder group that also might be important would be patients and the role of disease advocacy. And we already heard from Tom Bartlett and his very powerful story earlier. And just want to reference one example from the world of vaccines, because meningitis has been an area where we've seen quite a lot of patient advocacy and also disease charity involvement, and that's been to put attention and funding towards meningitis vaccines. But there's also been support for vaccine uptake through that advocacy work. Okay, so I think this is kind of set what we can learn from vaccines for infectious diseases, but I'm probably posing a few more questions than answers at this stage. And I'm really looking forward to seeing how this conversation develops further. So thank you very much.